And welcome back, welcome back. Oh, the crowd is in the house. You know, our next guest is Donna Willams, Dr. Donna Willams. The doctor is here. She's from Morningside Dental Care, and she joins us today to explain the importance of dental hygiene. Very important. We'll show you why. Give her another big round of applause, everybody. Dr. Donna Willams. So, tell us about your work. How did you get started in this, first of all? And what turned you on to it?
So, thank you very much for having me. I'm very excited to be here this morning. Yes. And, you know, I think I've always been, because my family's in the health field, so I always pretty much knew I wanted to go into the health field. However, when I was younger, I wore braces, so I was in my orthodontist's office for often and was able to see, you know, the tools and equipment that he had. And, you know, somebody who likes working with your hands, I found that to be pretty fascinating. Yeah. And so from a young age, I really had dental aspirations. After going through dental school, I, you know, really I enjoyed the process. But then, you know, I came out and I was a dentist. You know, it wasn't until taking a lot of continuing education classes and learning what's really out there in the world of dentistry that I really have this love, and it's just grown and grown. And
but when did it hit you? And when did you find out that, wow, I'm really a dentist?
Well, I mean, I knew that the moment I graduated.
But you haven't done any real work on it yet, right?
The moment I graduated, but actually, there's being a dentist, but there's that dentistry is so much more, and that we are really primary healthcare providers. And so it's more than just about, you know, I used to, my family, as physicians, you know, joke about, you know, it's just the teeth. You just have to brush and floss.
Yeah,
it's not important.
There's a whole lot more to it than the teeth.
Absolutely.
A whole lot of things are going on in your mouth.
So basically, our conversation that we're having this morning is because of our mouth and our teeth.
Yes.
You know, and it's so important. When you want to go to get your job, the first thing that people take a look at is your mouth and your smile. And having poor oral health and poor oral hygiene can actually prevent you from getting that great job that you might be interested in. From finding, you know, your perfect mate who might be interested in you, but then you smile and they're like, you know, maybe, maybe not. So for chewing, for so many things, the teeth are important. And then we've also found now that there's so many health issues that are related.
There is a correlation between what goes on in the mouth associated with your health.
Absolutely, absolutely. So we found diabetes, heart disease, stroke, even premature low birth weight babies are all related to infections in the mouth. And so by taking care of your mouth and taking care of your oral hygiene and your oral health, you can actually prevent a lot of these problems from getting worse.
There's some talk about older people getting heart attacks from bad teeth or rotted teeth.
The area of the body with the most bacteria is your mouth. So every time that you have bacteria in your mouth, and when your gums bleed, and you get a little blood on your toothbrush, you really don't think about it, you rinse it off, you go on. However, the bacteria are entering the bloodstream right from the mouth and going to other parts of the body and causing problems.
Wow.
Yeah.
Okay. So when did they start looking at that? Because for a long time it was just the teeth. Right? Just pull his tooth out and get it out of there.
So, you know, probably for the past 20 years or so, people have really started talking about that. But it wasn't, I would say within the past 10 years, there's really been a push to, you know, educate people on the importance of the oral health to total body health.
This is so important. What do you tell people upon finding out that they have some sort of situation going on with their gums, or knowing that bacteria can enter into the bloodstream and cause these problems like degenerative diseases, diabetes and such?
So basically the most important thing that I want to tell them is to make sure that you're keeping the levels of plaque and bacteria low. So you're going to do it by a couple of things. Number one, you're going to do it by watching your diet. So we really don't pay attention, but the sugars in our diet, the bacteria feed off of the sugars. So you want to make sure that you're eating foods that, I say whatever you put that's healthy for the rest of your body is what's healthy for your mouth. So cut down on a lot of the white sugar, white flour, eat fruits and vegetables, a lot of, whole wheat, those type of things are going to be a lot more beneficial for you. The other thing is your oral hygiene, making sure that you're brushing after each meal, flossing on a regular basis. You're not going to sleep at night without flossing your teeth and brushing, because the time that the bacteria build up a lot is when you're sleeping. And then the third thing is having regular dental visits. That's key. That's where we're going to get to the preventive, and we're going to get to finding out the diseases in the early stages so you can prevent them from getting to losing teeth, and then also the other health issues that come along with it.
A lot of people are shaking their heads.
So, yes. So one thing
I have to
about
get to my dentist.
gum disease is chronic. So once you've got it, you've always got to worry about it. Yes. It's silent, so that you may have bleeding gums, but you don't have any pain associated. So it's really, if the gums bleed, you're not paying attention. And it's contagious. So if you have gum disease and you are kissing your significant other,
you can give them gum disease.
You can be giving them gum disease. If you're a parent and you have gum disease, and you know how we like to feed our children off the same spoon that we use, you're transmitting bacteria that way as well.
Wow.
So it's so important, but we really don't pay attention. We don't think
Things
about
that
it.
make you say,
Yeah.
I'm going to run to the restroom and brush my teeth right away. Goggle. Have a bottle of water over there or something like that. Doctor, you're really creating a whole lot of awareness here. All right. So you have a number of programs that you're working with, too. Tell us about them.
So you're talking about within the...
You're doing things in the community, or the projects that you have?
So, within dentistry, we have complete health dentistry. And that's really the movement where, as dentists, since we see you more frequently than you may go to see your physician, we can diagnose a lot of things that are going on in early stages. I don't know how many times, countless, that I diagnose high blood pressure in the office. So,
really?
Yeah, people are walking around, have high blood pressure, don't realize that. And so certain things, you need to visit a primary care provider on a regular basis to check out.
So we can go to your office and sit in a chair, lean back, and get screened, basically, by opening our mouths.
Absolutely. Absolutely.
Wonderful. Now, a lot of the other dentists, they don't do that.
Some do not. However, it's a trend that is really going in that direction, so that more dentists are doing that. Because, when we went to dental school, we learned about the total body at the beginning. And then afterwards, you start focusing on the teeth and the gums. And you forget, there's a body associated. And so you have to always pay attention to how the person comes in. You're talking about stress and all of those things also that affect your oral health, and they affect your total body health as well.
Yeah. I mean, a lot of people go to dentists. I mean, how many people go to a dentist and find out that they have high blood pressure? You just go, they just do your teeth. They don't tell you about anything else.
Yes.
So this would be something new for me, at least. Unless it's been out there and I don't know yet. I'm just
diabetes,
finding out. Yeah.
Different things. I can look at a child who comes into the office who has a lot of tooth decay, who has gum disease, and I can kind of predict. Well, as they get older, they're probably going to have a problem with heart disease. They're probably going to have a problem with diabetes. So all of these things you can learn at early ages. Yeah. You can teach parents to make sure that their children's diets have improved. Well, the whole family has to improve their diet and make sure that they're being trained on going to get regular dental visits, that prevention is not painful.
Yeah. Give us some of those tips again.
So with regard to
how to prevent, how to curb all of those things that you spoke.
So of course it's definitely watching your diet. It's also making sure that you're brushing and flossing on a regular basis, and it's also making sure that you're going to visit your dentist regularly.
That's right. And where can we find you?
So our office is 527 Manhattan Avenue, and we're in Harlem.
Morningside Dental. Take a look.
Yes.
Right there. Thanks for coming by.
Thank you so much.
You got to come by and share more.
Absolutely.
Can we give her a show and dental hygiene? Because we're preventing all these diseases and all that stuff, not just looking at the teeth.
Exactly.
Thank you so much. Give her another big hand, everybody. The doctor's in the house, Dr. Donna Williams, Morningside Dental Care. Thanks so much for stopping by.
Thank you.
Stick around for a little while, okay?
Okay.
Okay.
All right.
We got to take a quick break right here, but coming up next, we'll get a preview of a networking event you won't want to miss. Stay tuned.